You want the plastic surgeon? If you insist. For context, this takes place at a large academic center in Canada where it is very common to have residents performing basic procedures. I once got a call as a senior resident from an emergency physician apologizing for consulting us for an irate woman with a small laceration on her hand, insisting that a plastic surgeon come to fix her right now. Of course, this was well within his scope of practice, but despite telling the patient this, she refused to allow just an EMERG doc to fix wound. He explains the situation and I decide that this would be an excellent opportunity for malicious compliance as well as teaching my junior resident. So I tell them not to worry, I'll be down when we finish in the OR in a few hours. So I go down to see the patient with my junior, who just happens to be an off-service EMERG resident. I examine the patient, and explain to the now impatient woman that Dr. Junior resident would be fixing her hand. Keep in mind by this point she has been waiting a few hours longer than she would have if she had let the EMERG doc fix her. So ironically, instead of having her hand fixed by an emergency physician who has likely done thousands of these, she has it done by a junior EMERG resident, who has done, like 2 or 3. And of course, I was there the entire time to ensure the resident did a satisfactory job, so it was more work for myself in the end.